The lab staff within the Ministry of Health, Wellness and the Environment have undergone an intensive 4 days training funded by the OECS Global Fund project. Under this project, Caribbean MedLab Foundation, which is the implementing arm, is responsible for training and assessment, and this training and assessment has occurred within 6 OECS countries, of which St. Vincent and the Grenadines is a recipient. The training is geared towards moving labs towards accreditation in a stepwise format. The first step is to achieve Tier 1 certification by December 2018. Under the training, it looks at urgent delegation of responsibility for QMS interpretation to a specific laboratory staff member at the National Laboratory who must be released from all other laboratory duties and responsible until the end of the project. Immediate conduct of a QMS sensitization training intervention for all lab staff and key stakeholders, and immediate recruitment of a short-term focused hands-on technical support to complete implementation of this Tier 1 by the end of 2018. In order to move laboratory strengthening process forward, the training is looking at taking the OECS Secretariat to provide travel and subsistence support for CML staff to conduct the 5-day QMS sensitization training. We spoke to persons who were part of the laboratory quality management system training and got their response. So we're here with Mr. Elliot Samuel, and he's a chief lab technologist, and we have been having 4 days of intensive training. Tell me a little bit about the training, what is the purpose, and what you hope to achieve.
Hi, St. Vincent, along with 6 other Caribbean countries, have been part of what is referred to as a LQMS, SIP. It's Laboratory Quality Management Stepwise Improvement Process Training that is being sponsored by the OECS Global Fund. We began the process in August of 2017, and coming off of that, we've had several inspections. The last inspection we had in June resulted in us being behind on some implementation targets. And as a result, it was recommended that we conduct a resensitization training for the laboratory staff. The entire project is really geared at assisting labs to achieve accreditation. But we are doing it in a stepwise format where, as opposed to taking on the gamut of all the implementation targets one time, it's really a tiered approach where we are trying to achieve what is referred to as Tier 1 implementation, which is going to allow us to be in a process where we can now be considered a lab that can achieve licensure. Okay, so the training is really about sensitizing the staff about all of the requirements of lab quality and lab quality management, quality assurance, and getting the entire staff on board so that we can implement all our targets to meet Tier 1 certification by December of 2018.
And what would this mean for St. Vincent once we've achieved this?
Well, the outcome is really to have labs accredited. And accreditation really translates into having data, information that is accurate, reliable, and that is delivered in a timely manner. Information in the sense that the product of the lab, a lot of people, when they think lab or when they hear lab, they tend to be in a little gray area as to what it is that the lab is providing. And we have been known over the years to be a point of testing, and we're trying to move away from that paradigm. The laboratory is really a point of information, and that's our product. The information is really used to guide clinical diagnosis and management and care of patients, as well as to provide information for public health intervention and for ministers of government to make decisions relating to healthcare. This information, because of what the information is used for, it has to be accurate, it has to be reliable, it has to be timely. And our quality management systems actually allow for the management of that information, ensuring that the information is meeting all of the tenets of a quality system.
So we're talking with one of the participants in the workshop. Can you just tell me your name and how have you found this workshop so far?
My name is Stacey Bacchus. The workshop has been very informative. It has been an eye-opener, especially when it comes to quality, which is a very important topic.
How do you think this workshop will enhance the work that you do at the lab?
Quality, yes. Enhancement, big. Quality is everything. Everything that we do has to do with quality. So in terms of make us more marketable, it will show our clients that what we produce has been authorized and you're getting a reliable results and the results that you can trust.
What has been the general response of the participants in the workshop? 4 days, it's been intensive. You're one of the participants. What is the general consensus of the group?
The group is taking it as very positive. They are very proactive. So they are asking questions, questions are being answered as well. So everyone is learning a lot of information from this.
Do you think this tier of the program would be successful for St. Vincent and the Grenadines?
I see it as being very successful, but for its success, we need everyone's assistance. So we need ministry's assistance as well as the lab staff assistance, so which we are doing right now, working hand in hand.
So we're here with the facilitator for the program, and she's representing Caribbean MedLab Foundation. You're going to tell me a little bit about, you're going to tell me your name and your role here as facilitator of the program.
Hi, good morning, and thanks for having us here. I'm here facilitating a program actually on quality management systems implementation or improvement for the laboratory. The laboratory is moving towards accreditation, standardization of practice. So this workshop is readying them to move towards a deadline actually that we have for December, in which they have to achieve the first step in the accreditation process.
This is the final day of a 4 days intensive training. How ready would you say they are? Or do you think they would achieve this by December 2018?
I'd say that I hope they will, okay? And I think they're all fired up now and anxious to go. And they have been working with this for some time. The lab has actually been engaged in a quality improvement effort for a few years now. And the good thing is that medical labs are setting the pace for quality improvement in health. And so once the lab has actually achieved this, then they help to move the rest of the health system, the hospitals, etc., forward. So we're hoping that the lab can finally, by the end of December, say, yes, we have achieved the tier 1 of the laboratory quality management stepwise improvement process using a variety of tools and under the Global Fund project, actually, which is supporting the lab's effort to improve quality.
This has been done in 5 other OECS countries. What is the importance of getting these 6 OECS countries at the level that you guys are working at currently?
This has actually been done across the entire region, and we have been working with this effort, I'd say, since 2004 or so. It's a long process, okay, upwards process, but labs have been inching forward slowly and surely. This particular effort is actually 6 OECS countries through the Global Fund project to improve HIV and TB diagnosis, treatment, and care in the OECS. So the lab is building on the capacity they have built previously. Importance is that at the end of the day, patients need lab testing supports, in fact, many things. It supports clinical care and treatment. It supports public health, surveillance, information. It supports policy development. And so part of the whole lab effort, and it involves the chief medical officers, the permanent secretaries, etc. We actually just had a meeting of chief medical officers and permanent secretaries in driving forward the implementation of national laboratory policy across the region and certainly within the OECS in particular, and regulation of laboratories, long in coming, okay? But hopefully we now just at the point when this is going to happen.